the next thing we're going to talk about here tonight is exercise. We're not trainers. We're not going to follow you home or follow you to the gym and say, okay, make sure you run for 45 minutes and make sure you do 30 minutes of weight training and then make sure you do a cool down, stretch, go in the sauna. We're not going to do all that. But it's important to make sure that every chiropractic patient has a good exercise program, and the reason for that is a lot of times when we see patients come in here and their spine's a little crooked here, how balanced do you think the muscles are on each side? They're not, right? The muscles on this side over here are being stretched, and the muscles on this side over here are too tight. So we do our best, try to get your spine as straight as possible, excuse me, and then when we get done doing all your active rehab, your stretches and exercises that we give you, it's part of making sure that this spine gets back as straight as possible, because if we don't have the right muscle tone on each side, eventually what's going to happen when you start coming in here? It's going to want to go right back. If we don't build those muscles up on each side to where it's even and has a proper tone to help support your spine, okay? And they also say an extra 1 pound of body fat on your body creates an extra 3 pounds on your spine. So if we don't exercise, not only are we going to gain weight and put more stress on our spine, but it's not going to make sure we have the proper tone in the muscles, okay? So exercise is very, very important.